Hello friends, welcome back to my YouTube channel. Today class we will discuss about image-based questions for NORCET and other nursing competitive exams. So let's begin. Biopsy gun. Used to take out a sample of a lump, tumor or other area. Swab stick with tube. Used to diagnostics, sample collection, cleaning wounds, applying medicines and cosmetic procedures, ensuring hygiene and preventing contamination. Chemotherapy chemoport. Used to provides long-term, direct access to a large vein for various treatments, including chemotherapy, drawing blood for analysis, administering other 4 medications, and providing total parenteral nutrition. Bone marrow biopsy needle. Used to take samples of bone marrow tissue for diagnostic testing and in some cases to deliver drugs or fluids into the bone marrow. Lumbar puncture or spinal tap is a medical procedure where a healthcare provider inserts a needle into the lower back to collect a sample of cerebrospinal fluid, CSF, that cushions the brain and spinal cord. Lumbar puncture needle and their size and color code. Blood culture bottle. Used to diagnose bloodstream infections, BSIs, such as sepsis by providing a sterile, nutrient-rich environment for microorganisms from a patient's blood to grow and multiply. Portable medical X-ray machines. Mobile devices that deliver diagnostic imaging at a patient's location, such as a bedside in a hospital or a remote clinic. MRI machine. Used to create highly detailed images of the body's soft tissues, organs, bones, and blood vessels, primarily to diagnose, monitor, or guide treatment for various medical conditions. CT scan machine. Used detailed cross-sectional images of the body to diagnose injuries and diseases, guide medical procedures like biopsies and surgeries, and plan treatments such as radiation therapy. Difference between MRI and CT scan machines. CT scan, computed tomography, uses X-rays to take multiple cross-sectional images of the body. MRI, magnetic resonance imaging, uses strong magnetic fields and radio waves, not radiation, to create detailed images. CT scan for bone fractures, chest and lung diseases, trauma and internal bleeding, detecting cancers quickly. MRI for brain, spinal cord, nerves, muscles, ligaments, joints. Soft tissue detail, tumors, discs, cartilage. Meнгini liver biopsy needle. Used for performing liver biopsies by suctioning out tissue fragments without the need for rotation, minimizing trauma and blood contamination in the highly vascularized organ. VTM tube. Viral transport medium tube. Small blue diamond. It is a specially designed tube used for collection, transport, and storage of clinical specimens that may contain viruses like COVID-19, influenza, etc., before laboratory testing. 1. Tube, sterile plastic tube with a secure cap. 2. Transport medium, VTM, liquid that protects the virus from drying out and maintains viability during transport. 3. Swabs, usually nasopharyngeal or oropharyngeal swabs, are provided. Uses: collection of samples for RT-PCR, viral culture, antigen antibody tests. Maintains the virus in an inactive but stable form for safe transfer. Commonly used in COVID-19 testing kits. Defibrillator machine. Used to apply an electric charge or current to the heart to restore a normal heartbeat. If the heart rhythm stops due to cardiac arrest, a defibrillator may help it start beating again. Automated external defibrillator machine AED. Used to treat sudden cardiac arrest SCA by delivering an electric shock to the heart to restore a normal heart rhythm. X-ray machines. Used to diagnose medical conditions like bone fractures, arthritis, pneumonia, and tumors by producing images of the inside of the body. The biohazard symbol is an internationally recognized sign that warns about the presence of biological hazards which can pose a threat to human health or the environment. Radiation symbol, also called the trefoil symbol, is an international warning sign for ionizing radiation. Feeding jejunostomy (FJ) tube is a surgically placed tube into the small intestine, jejunum, to provide enteral nutrition used when a patient cannot eat by mouth or cannot tolerate gastric feeding. Gastrostomy tube (G-tube) used to provide long-term liquid food, medicine, and fluids directly to the stomach when a person cannot eat or swallow adequately, or to drain air and fluid from the stomach. Percussion hammer or reflex hammer is used to test deep tendon reflexes, which helps to assess the patient's nervous system. By gently tapping a patient's tendons at various points, such as the knee or elbow. Tuning forks uses to diagnostic tests like the Weber and Rinne tests for hearing loss and vibration sense assessment and to help detect bone fractures. Enoxaparin sodium injection used to prevent blood clots. Lantus insulin is a long-acting insulin used to treat diabetes. Dennis Brown intestinal forceps used for grasping tissues for manipulation. It can be used to perform dissection as well as homeostatic packing during surgical procedures. Dennis Brown splint is a specialized medical device designed to treat conditions such as clubfoot and developmental dysplasia of the hip, DDH. Colostomy bag use is to collect feces when a surgical opening, stoma, is created in the abdomen to bypass part of the large intestine. Urometer used to measure hourly urine output for patients who need close monitoring of their fluid balance and renal function. Pulse oximeter used to measure the percentage of oxygen in your blood oxygen saturation, and your pulse rate. Pulse oximetry. Self-monitoring. Inexpensive. Painless. Non-invasive. Medical or home care. Measures oxygen saturation. Aortic punch. Used by cardiologists and thoracic surgeons to create clean, circular incisions in the aorta or other major arteries during complex procedures like coronary artery bypass, grafting, etc. Dennis Brown retractor used for retracting hollow organs as well as cavities during general surgery. Dennis Brown tonsil holding forceps used to hold the tonsil during tonsillectomy. Pacemaker. A pacemaker is an electronic device that treats slow, fast, or irregular heartbeats and certain types of heart failure by sending electrical pulses to the heart to regulate its rate and rhythm. Heart-lung machine or cardiopulmonary bypass (CPB) machine is used during open-heart surgery to temporarily perform the functions of the patient's heart and lungs. Phototherapy machine use specific wavelengths of light to treat various conditions, most commonly neonatal jaundice by breaking down bilirubin in newborns. Transcutaneous bilirubinometer used to non-invasively screen for jaundice in newborns by measuring the yellow color of the skin and estimating the total serum bilirubin (TSB) level. Electrosurgical unit or electrocautery machine Uses heat from an electrical current or chemical reaction to destroy tissue, stop bleeding, and make precise cuts during surgery. Monopolar cautery pencil. Used in electrosurgery to cut, coagulate, and dissect biological tissue by delivering controlled heat via a radiofrequency alternating current. Surgical grounding pad, neutral electrode or return pad. Used in electrosurgery to provide a return path for high-frequency electrical current, preventing the current from harming the patient by burning tissue. Bipolar cautery forceps and cable. Used for precise cutting and coagulation of tissue during surgery by passing an electrical current only between the two tips of the instrument, providing localized control and reducing risks for patients with pacemakers. Ophthalmoscopy. Used in ophthalmoscopy, a procedure where a healthcare provider examines the back of the eye, the fundus, by shining a light through the pupil. This allows them to view the retina, optic disc, and retinal blood vessels to detect signs of eye diseases like glaucoma and diabetic retinopathy, etc. Snellen chart. Position the patient 20 feet away from the chart under good lighting, ensuring they wear current-corrective lenses. One eye is then covered, and the patient reads the letters aloud, starting from the top. The smallest line they can read correctly determines their visual, with the top number of the fraction being the distance tested, 20 feet, and the bottom number being the distance a person with normal vision can read that same line. Eye tonometry. Uses an instrument to measure intraocular pressure, IOP, the fluid pressure inside the eye. To screen for, diagnose, and monitor glaucoma and ocular hypertension. Slit lamp. Used by eye care professionals to get a magnified, stereoscopic view of the eye's structures, which helps in diagnosing and monitoring a wide range of eye conditions like cataracts, glaucoma, and infections by examining the cornea, lens, iris, and other parts of the eye. Microscopes. Used to observe and analyze structures too small to be seen with the naked eye, enabling detailed study of cells, microorganisms, and tissues. Otoscope. Uses light and magnification to allow healthcare professionals to examine the ear canal and eardrum. Thank you for watching this video. I hope it was useful. Please like, share and subscribe this channel for more videos. Thank you.